Hello and welcome to the virtual coffee break with the Michigan State University Extension Dairy Team. I'm going to be your host today. I'm Marianne Buza. I am a dairy educator with MSU. I am located in Huron County and cover the thumb area of the state. And with me today is Dr. Pam Ruegg. Dr. Ruegg is the head of the Animal Science Department, and she is also an expert on the prevention and treatment of bovine mastitis and on-farm factors that influence milk quality and safety. Her research interests are focused around the application of epidemiological techniques to critical issues related to milk quality and safety. So we're so happy that you're here today, and we're going to talk about some mastitis issues and using antibiotics to treat it. So again, thank you for being here.
I appreciate the opportunity to talk about a subject that I'm passionate about.
When we were speaking earlier, you shared with me that you were wrapping up a study that involves 40 large farms in Wisconsin, and can you go ahead and share about that?
Yeah, so I've been working in the area of antibiotic usage for about 20 years of my career. And about, 10 years ago, we did a study of antibiotic usage on small dairy farms. It was one of the first published in the US. And then a couple of years ago, as this topic has gotten more and more important, we got funding from the USDA to study antibiotic usage on large dairy farms. I got that funding right before I moved from University of Wisconsin back here to my home state of Michigan. And we collected the data on 40 large dairy farms in Wisconsin in the last 4 months of 2017, which were my last 4 months living in Wisconsin.
Can you define a large farm as according to this research study?
Yeah, in this particular research study, we enrolled farms that had at least 200 dairy cows, and that turned out to our average herd size in the study turned out to be about 1,000 cows. So the study consists of 40 large dairy farms that contain about 53,000 lactating dairy cows.
Wow, that's a lot.
Yeah, as being back here in Michigan, I'd say these farms are very similar to the large dairy farms here in Michigan. So I think the results of this study are probably 100% applicable to our Michigan farms as well.
Great. So what did you find in this study? Can you share some of your results?
Yeah. So we went to these farms, and first of all, the farms were required to use antibiotics. So that was part of their criteria for enrolling in the study. They had to use antibiotics on the farms, and they had to have electronic records, dairy health records and management records, and they had to have a system for recording their treatments in their records. So these aren't like random farms. These are actually really good farms. So there are farms that record antibiotic treatments in computerized systems and do a pretty good job of defining and detecting disease. So we visited these farms, and before we visited them, we got downloads of all their data for the last year, their animal health data. We looked through extensively all of that data, and we probably spent 2 days analyzing that data for each herd before we ever visited the farm. Then we spent a full day, we spent several hours on the farm doing a survey, and then we got all of their purchase records.
Okay.
So it's an enormous data set of antibiotic usage, and we haven't finished analyzing all of it yet. But what we did first was we went in and we summed up all the doses of antibiotics used on these farms and ranked them from least usage to highest usage. And actually about a year ago, all of these farms got a report showing how their usage compared to the other farms in this data set. And one of the really interesting outcomes was how much variation there is. So when we looked at the doses of antibiotics used in this data set, the highest using farms used about 5 to 6 times more antibiotics than the lowest using farms. And that was a really interesting factor or outcome of the study, because it tells us that there's room to improve the way antibiotics are used on farms.
Absolutely.
Because the variation is so huge. If we found very little variation, then we would have said, well, not much we can do. But in this instance, it told us there's stuff we can do to improve our antibiotic usage.
And you were looking for overall usage, so not just mastitis, but you were looking at pneumonia and hoof health.
Yeah. So in our study, we looked at all uses of antibiotics in lactating dairy cattle and in pre-weaned calves. We do not have data on that on those weaned calves up to about 20 months of age. And that data turned out to be really hard to get, because many large farms send those animals somewhere else. They may send them to Kansas or Texas or New Mexico or somewhere. We also don't think that data is as important, because that group of animals is at really low risk for disease, typically. A lot less disease going on in that kind of mid-range. So what we found in our data is the most common use of antibiotics on dairy, in adult dairy cows, is by far mastitis. And that's both treatment and prevention of mastitis. That's about somewhere between 65 to 85% of all antibiotic doses. The second most common use of antibiotics on farms is injectable antibiotics given for reproductive purposes, either metritis or retained placenta in some reason. And then the third is pretty close between third and fourth are treatments for foot infections or treatments for pneumonia. So when we look at trying to impact that, the area that we have the most ability to reduce antimicrobial usage is the area of mastitis.
Yeah, definitely sounds like we're using most of our antibiotics in that area rather than pneumonia or reproductive issues. So did you work with any of these large farms once that you gave their report back, before you came to Michigan, or did any of the other professors on the project to help them reduce their use of antibiotics? Did they want to reduce their use of antibiotics once you showed them that they're, so much higher than their peers?
Well, actually, that's a longer term aspect of the study. What we've actually done, this study is still going on. It's very active. We enrolled the 4 highest using farms and the 4 lowest using farms in further studies.
Okay.
And we've completed focus groups on all of those farms with farm workers. And we're also, as part of the bigger study, looking to see if there's any risk of transmission of antibiotic resistance genes between animals and people on these farms.
Oh.
So this study actually has medical doctors and epidemiologists and farm safety people working on it as well.
Okay. Did you, when you were still in Wisconsin, did you test for antibiotic resistance for any of these herds?
Well, we're still doing that.
Okay,
I'm
you're
still the
working
leader
on
of
it.
this
Yeah.
project, even though I'm in Michigan. I go back about every 3 months to work on this project. And by the way, this project has paused this week as well, data collection.
Right.
But yeah, I have a grad student here analyzing data, and then I work with my broader team there. And that the antibiotic resistance question continues to be looked at, and we're working on that actively right now. But I can't report anything on that yet. We're not that far along.
Okay. So from the study, you found that 65 to 85% of antibiotic use is going to be for mastitis. So how can we as an industry, the dairy industry, try and focus our use on antibiotics to reduce that and be more responsible?
Yeah, so that we know that mastitis most of the time on most farms is a disease that presents as either mild or moderate symptoms, which means that in most instances on most farms, it's when we find mastitis, it's either just abnormal milk or abnormal milk in a swollen quarter combined with reduced milk yield. And in those instances, it's not a medical emergency. So the key thing that we need to do with mastitis is figure out, would that particular non-severe case benefit from the use of antibiotics, or would that particular animal have a sufficient immune response to the type of pathogen that's infecting her so that she'll spontaneously eliminate that pathogen. And so to do that and implement that on farms, that's the origin of course, these selective treatment programs that are based on the use of on-farm culturing.
Mm-hmm. So once we detect mastitis on these farms, we, obviously that animal is already having a reaction, right? She's already, we talked about how she's already has the inflammation, right? And that means she's already started to react. So did that lead you to a new research path as to figure out how often these cows are going to spontaneously cure their mastitis because we are catching it so late?
So that's a great question, Marianne. A couple take homes on this. One is I want to reinforce the value of doing monthly somatic cell count testing, because many cows are subclinically infected for many months before we ever see clinical signs. Right. And that'll help us guide our treatment decisions, because those cows that have a long period of having a subclinical infection before you see a clinical case are often infected with the type of pathogen that may require an antibiotic. Whereas cows that have had a low somatic cell count until maybe the month before their case, or maybe their cell count never went up, those infections are often by gram-negative bacteria, and those gram-negative bacteria often have very high rates of spontaneous cure, and we don't need to use antibiotics. If we have the somatic cell count data for cows, that alone can help us make some decisions relative to the need of antibiotics. And then when we combine that with the use of treatment data done either with treatments done either on-farm culturing or in the local vet clinic, we can get really good idea of whether or not we need to use antibiotics. Mm-hmm. And in most instances, probably only about 40% of the cases that present with mild to moderate clinical mastitis will actually require the use of antibiotics.
So if you have cows that have a high somatic cell count but no clinical signs of mastitis, do you recommend that maybe they get cultured?
Yeah, I do know what you mean, actually. Subclinical mastitis is a really annoying, frustrating, and confusing state of the disease. And subclinical mastitis means, of course, you've got one or more quarters in that cow that has constant inflammation. So the cow's somatic cell count is above about 200,000. Mm-hmm. And that's a really good indicator that you've got an intramammary infection going on there. And then the logical question is, should we treat those? Will it prevent more clinical mastitis, or will it benefit the cow? Mm-hmm. And the answer to that almost uniformly, with few exceptions on farms, is no, that is not a good use of antibiotics. Okay. And there's a few reasons for that. If you culture a subclinical case, about 50% of those cases will be culture negative, even though the cell count remains high. That's not the same as a culture negative clinical case. A culture negative clinical case, we know through the studies we've done, 85% of the time their outcomes are outstanding. They don't recur, their cell count drops in about 4 to 6 weeks, they're a cure. A culture negative chronic subclinical case often remains chronically subclinical. Okay. And the reason they're culture negative is they're actually a false negative. Okay. what the reason they're negative is because there's a lot of white blood cells reducing the number of colonies in that gland to below the detection limit in the lab.
Okay.
And if you use antibiotics to treat those, you're going to have to throw milk away that you can sell.
Right.
So the cost of that usually exceeds any potential benefit, because your cure rate maybe is going to be 40-50% on those.
Right.
The cell count goes down gradually. So a much better strategy is to segregate those cows so they don't infect other cows, and make individual cow decisions on those in consultation with the local vet.
Okay. I think we can both agree that prevention is the best way to get reduced mastitis on your farm rather than having to treat it with antibiotics. Can you talk a little bit about your some recommendations you might have for farmers looking to prevent mastitis?
Yeah, in the economic times we're in and the economic times we're looking at, I cannot emphasize the difference between money spent on prevention and money spent on treatment. When we spend dollars to prevent mastitis, for example, having a good teat dip, training our milking technicians to do a great job in the milking parlor, ensuring our pre and postpartum facilities are dry and clean, making sure our bedding is dry, making sure we have enough stalls for cows. Anything we do, any dollars we spend on prevention, that's an investment. When we already get disease, when we get high cell count cows, when we get clinical cases, dollars we spend on treatment, we're trying to limit the losses. So that's a loss. So if we have to choose how to spend our scarce resources on farms, we really want to make sure we prioritize prevention.
Mm-hmm.
And so don't cut your employees to the bare bones. Make sure that your milking technicians are well trained. Make sure you're using an effective pre and post milking teat dip. Make sure that you're doing somatic cell count testing so you can identify cows that need to be segregated or cows that are chronic, and making those decisions. Those things we've got to maintain. And when we look at treatment, we've got to make sure that our treatment decisions are both cost effective and maintain the welfare of the animals. But we certainly can't look at those as the primary way to control mastitis.
In Michigan, and especially in today's economic climate, a lot of producers are tempted to overstock their freestall barns. Some as much as 120% and some as much as 150 or more percent. What kind of impact would that have on your mastitis?
Yeah, I really understand the reason producers overstock. I completely understand it, but there's a consequence to that decision. And the consequence of that decision, whenever we put more animals in a smaller space, in other words, increase the density of the number of animals in a space, we concentrate the amount of manure in that space. We reduce the probability that the area that they lay down will be dry. And I have to really emphasize, moisture control on the beds is incredibly important to reducing exposure to mastitis pathogens. So overstocking definitely increases mastitis risk. So what do I tell people on a practical basis? If you have to overstock, do it on the least vulnerable animals. So those most vulnerable animals are the older cows, okay, with the bigger udders. The most vulnerable animals are early lactation animals. You've got to really think strategically. You want to have your pre and post calving pens as least overstocked as possible. You want to really focus on that early lactation to maintain the health of animals. Once an animal becomes infected, she's likely to remain infected in many instances. And even if she cures from that infection, she has increased risk of new infections. So the more we can do in early lactation, the more we can do to keep the vulnerable animals healthy, the better it'll pay off in the long run.
Yeah. So where do you think antibiotic use is going to go in the dairy industry in the future?
So if you look around the world at the trends, I have no question that I can confidently predict that use of antibiotics on dairy farms is going to come under increased scrutiny, and there's going to need to be increased justification for the use of antibiotics. And as I say that, I want to say, compared to other industries, we're doing a pretty darn good job already.
Absolutely.
Yeah, dairy cattle have only really some very discrete risk periods when for infectious diseases caused by bacteria. If you look at adult cows, we're looking at the pre and post calving period as the highest risk for developing infectious disease. If we look at baby calves, it's the pre-wean calves. So we can focus our emphasis on those areas because there's no question in the future we're going to be asked to reduce our antibiotic usage and justify why we're using them.
Okay. So if that's the case, can you speak about maybe some projects that you have going on to look at how you can pair on-farm culturing with mastitis treatment?
Yeah, we've got a study done here in Michigan, sponsored by MAAA, that is currently on pause, but we've had good participation by some commercial dairy farms. And as we come out of this research pause and come out of this COVID crisis, we'll be looking for a few more farms to complete, where we're trying to figure out how antibiotics should be used to treat mastitis that's caused by gram-positive pathogens, streptococci, coagulase negative staph. We're doing this study because we've already done clinical studies looking at no growths and gram negatives. We know the answers to those, but we still have questions on are there differences among different types of antibiotics? Do they have different efficacies? And should we treat short? Should we treat long? Are there some coagulase negative staphs that don't require any treatments? So we're really trying to answer that question. I'm working with my grad student, Quinn Kolar, and we've going to be looking for more herds. We're probably going to need a couple more herds because we need about 600 cases of clinical mastitis caused by gram-positive pathogens in this study. And so far, our collaborators were somewhere between 300 and 400 cases. So stay tuned.
And you mentioned MAAA, and that's the Michigan Alliance for Animal Agriculture. So for those of you who don't know, they sponsor different research programs in animal agriculture. They're funded by the state of Michigan, but we are currently are not receiving any funds from them. So, it's a great program and can do great things for applied animal research. Yeah, with that, I think that's all the time we have today. So thank you, Pam, for being here today. I appreciate your time.
Thank you, Marianne, and everybody stay socially distanced and stay safe, and thank you for all you're doing to supply us with milk and dairy products.